Hello and thank you so much for joining us today for the webinar Value Preservation and Hygiene Management in the Dental Office. It is a great pleasure to introduce to you Mrs. Ulrike Nagorr. Her aim during this presentation will be to address how to handle hygiene requirements based on legal provisions and how to translate them into a proper cleaning and maintenance process without losing the longevity of instruments and equipment. We would like to thank Mrs. Ulrike Nagorr for being with us today and our sponsor KaVo for making this lecture possible. Please take note of any questions and comments you have during the lecture, as they will be addressed by the speaker at the end of the presentation. Without any further delay, please help me welcome the expert herself, Mrs. Ulrike Nagorr.
So, thank you. Good afternoon, ladies and gentlemen, and welcome to our webinar, Value Preservation and Hygiene Management in Dental Office. Why did we select this topic for an online training? Every day our distributors in your countries, our sales and service colleagues there receive many questions from your dear dentists and teams about hygiene features and functions of KaVo products. Often you are faced with statements as "this is according to RKI or DVGW." Particularly when it comes to configuration of a treatment unit, the question is raised, why should I spend a certain amount of money more into certain optional feature? On example of German hygiene regulations, we would like to point out why it could make sense having hygiene features in your focus. Hygiene features and functions provide additional benefits for you when treating specific sensitive patients on one hand. On the other hand, they help you to protect functionality and value of your investment and to avoid unforeseen high repair expenses. Our webinar will show you how KaVo treatment units and instruments help you considering both hygiene management and value preservation in your daily workflow. Our agenda for today's webinar is split into two parts. We will first speak about the hygiene management and value preservation for the treatment units. We will have a look into the water hygiene norms and regulations that are necessary for water quality in the treatment unit itself. We will look into different features, and I will also introduce hygiene and maintenance plan for this hygiene management. The second part of our agenda is about the instruments reprocessing. Again, we will look into risk management, workflow, and reprocessing. We will look into the workflow, the plans, features, and of course have some additional information about products and documentation. Before we go into these topics, I have one or two questions for you. Do you know what your treatment unit is doing for you day by day over many years? If we assume a treatment unit is in your dental office for around 12 years, an amount of about 100,000 liters of water will flow through it. We assume that you perform around 35,000 treatments within around 20,000 operating hours, and during this time your suction system works around 4,000 hours for you. And of course, it's your high interest that all these technical functions will serve you over the whole lifetime of the unit without any problems. What is the problem in a dental treatment unit? It could be the water quality, and therefore the topic of water hygiene reprocessing maintenance in treatment unit is an essential topic. All of you know graphics like you see on the slide on the left side, how a biofilm is growing up, establishing into some environments. Here now we have the environment of the tubings inside the dental treatment unit. And if we allow to grow the biofilm, to let it really mature inside the very, very slim tubings for supply of the spray water, the spray cooling of our syringe water or the cup filler, this could lead to real serious problems. How this could look inside a unit's body, what usually you don't see, it is shown on this small picture on the right side of the slide, where you see a very thick layer of a biofilm that has established in a water inlet system of a treatment unit. And of course, especially when in combination to this biofilm is added additionally a higher temperature than usually, there is a danger not only of building up a normal biofilm, but also quite dangerous microorganisms as Legionella, for example. So, and we could, of course, ask ourselves, do we like to be the first patient in the morning in a dental office on a dental chair? When a treatment unit is installed, we give quite clear statements in our technical documentation and user manual how the water quality for the treatment unit should be considered. Of course, this topic is under responsibility to be checked by your distributors, by the engineer, and what also would be possible that you, for example, call your city water supplier before to learn just what is the water quality in your region of the country or of the city. We give recommendation about the hardness of the water. If the water is harder than 12 degrees DH, we recommend an ion exchange device for just reducing this hardness. If the water is too soft, that the softness is below 8.4 degrees DH, the growth process of algae could be a much higher one, and so yeah, it's also not the best way if the water is too soft. But here in this topic, please get in contact with your distributor, with your service engineer who is setting up the water supply lines in your dental office. On this slide, you will see a lot of German norms and regulations that are standing behind how the water quality has to be here in Germany for supplying the right water quality to the patient's mouth. That means here we speak about patient's water. Water that is coming through the instruments in the cooling spray, that is coming through the syringes and also into the cup filler. And you see, these are many norms, guidelines, and worksheets which mainly state two essential points. Here you see those a little bit strange letters for non-German speaking persons, RKI, what you have probably heard many, many times. There is this statement in this guideline that the water should be in drinking water quality. And German norms and regulations say that the accumulation of microorganisms in drinking water should not exceed 100 colony building units per milliliter. So this is an essential point regarding the water quality. Altogether, the water that is coming into the treatment unit should already fulfill drinking water norms before it comes into the treatment unit. And the second major regulation that we do have is that water which once was in a treatment unit should not flow back in any cases into the city water supply line. And this you find in this norm 1717 or in different DVGW worksheets. And one essential point is here this so-called free fall of water. That means water supply line should be interrupted, that no water can flow back into city water. So for those of you who never heard so far or just were wondering what is this DVGW, I added some information out of the world of Google. You can just enter the letters DVGW into Google and will be led to the page of this organization. DVGW is an abbreviation for the German Technical and Scientific Association for Gas and Water. This organization exists since the mid of the 19th century, so it's nothing new. And the focus of DVGW is on safety, hygiene, and environmental protection, taking efficiency and cost effectiveness into consideration in a standardized workflow organization, and here in promoting different technologies. So this organization has got the headquarters in Bonn, and in the meantime is cooperating with many similar organizations all over Europe, or even organizations outside Europe, with the key topic to transfer the know-how for more than 1 century in gas and water technical standards and communicate in all these technological manners. You see, I have this text here in English language. That means you can easily switch the page to English language as well if you like to receive further information. So how all these norms DVGW are fulfilled in a KaVo treatment unit. We do have as a standard feature in our premium units, for example, the E70 or E80, a so-called water block DVGW. You'll find the statement in the literature, in the product literature, and maybe you didn't see it so far here on this slide. On the right top of the slide, you can see how this DVGW water block does look like. It's a quite big part located in the unit's body of the treatment units. As I mentioned, in the premium units, it's a standard feature. It's already included in any basic specification. In our units as 1058 or E50, for example, this water block can be selected as an option. This water block, you see, contains of 2 different chambers, and via these 2 water chambers, it is realizing this required by DVGW guidelines waterfall. That means the interruption of the waterfall. It provides a water filter inside and also pressure regulation for the appropriate supply of the water to the different outlets of instruments or cup filler. Furthermore, therein are also safety measures, as for example leak sensors in order to avoid leakage sensors in order to avoid floods in case of pressure loss overnight, for example, somewhere in the dental office. The water block also takes over the function of germ reduction, now already within the treatment unit, and here it fulfills two different types of germ reduction functions. It's a permanent germ reduction function where a certain disinfectant or germ reductant, the KaVo Oxygenal 6, is being added permanently, continuously into the water supply lines in order to reduce the biofilm or avoiding a building up, a growth of biofilm inside the very, very thin lines of the water supply tubings and instruments. This permanent germ reduction does have a quite big functionality, not only for the treatment units, but already also for the dental instruments. Quite often we see that especially high-speed instruments come into service repair with blocked spray nozzles, and very often the spray nozzle is not blocked from any tooth debris or whatever out of the preparation, but with biofilm that is supplied into the spray nozzles from the tubings of the treatment unit. So here we have, with the big water block, already a permanent germ reduction process. In addition to that, the big water block provides an automatic intensive germ reduction process, which is being run or activated over periods of stagnation in water lines. Here just this oxygenal concentration is increased around 10 times. Of course, during these times the water is not in contact with the patient. That means there is no danger. What could be periods of stagnation? Of course, this is our vacation, periods of stagnation of water inside the treatment units, and it are different reasons when a practice is closed, unforeseen, for more than 24 hours. In accordance to the German norms, we have here from the RKI, the Robert Koch Institute, we do provide also a rinsing function of patient water supply lines, and this rinsing function is to be run in the mornings, as of course also overnight. Microorganisms, biofilm is accumulating, growing in the lines, and in between two patients. That means two different rinsing functions are available, one which is for 2 minutes of each tubing or outlet, and the second one for 20 seconds. This is again according to the regulations. For all of you who say, yes, this big water block might be an option for my 1058 or for the E50, but I'm looking for something what is more economic. We provide a manual function of permanent and intensive germ reduction via a so-called option of a water bottle, DVGW. Another name is pressurized water bottle. You see this accessory here added to the unit's body as well, and out of this pressurized bottle again the water is taken in a mixture with the oxygenal, but this has to be added manually for permanent germ reduction or with a higher concentration than for intensive germ reduction. The big benefit of this bottle system is, as I mentioned already, it could be the economic solution for your individual case situation, and it provides in autarkical control to patients water for all regions with poor water quality, or if you are facing quite often interruptions in city water supply in your region, in your building, city, or wherever. The water bottle requires a real strong and permanent education of the practice team on correct workflow. This is one of the most important topics when a unit is equipped with a bottle system. And of course, it requires high efforts and high work time investments in setting up correct workflow and supervision. That means the user should know how to fill the bottle, how to add in the right concentration the disinfection or germ reducing agent, the oxygenal, that it has to be refilled over the day, cleaned, and so on and so on. Yeah? So it needs much more efforts. A few words about the agent itself. We use for the germ reduction the KaVo Oxygenal number 6. We use this agent for more than 25 years in our water supply systems of the treatment units and provide herewith an environment-friendly disinfectant. It's based on hydrogen peroxide in 6% concentration, therefore the number 6, and additional silver ions. Oxygenal dissolves just in water and oxygen. That means it does not lead to any contamination of the water, and also the silver concentration is as low as possible to avoid any toxic concentration. We have proofs for the efficiency and experience for more than 25 years. Here on the right side of the slide, you see just an example of such a test report of one of the German institutions, laboratories, hygiene laboratories. The use of Oxygenal is, of course, an economic one. You have a quite long durability of the material. It's minimum 2 years. One bottle is approximately durable for 1 month. If we presume a cost of 20 euro, the cost per patient would be just in a value of 10 euro cent. So that means it's not as expensive for the good quality of the water you are getting. In some situations, we are faced with the use of other disinfectants for the water. And here on this picture on the right side of the slide, you see what happens, for example, if chlor-containing disinfecting agents are used instead of the Oxygenal. This can lead to corrosion of stainless steel parts, even involving the acrylic parts, and destroying materials. The Oxygenal itself, it is tested, of course, according to the German DVGW requirements, and provide good, cooperation with the different materials that are used in the treatment units. And we have many of them. Of course, we have some synthetic materials as the tubings, the instruments tubings. We have elastomers, some sealings inside the tubings, the metal parts, of course, stainless steel or brass, and surface coatings as, for example, the Teflon layer that KaVo instruments tubings do have inside in order to avoid or minimize the attachment of biofilm already construction-wise inside the tubings. Sometimes it might be necessary to have a prophylactic germ reduction device, especially when in a certain country the city water is not of a very, very good quality. Here in Germany we have a clear statement, as all over the cities and the waterworks in the different regions have to follow the DVGW regulations. No permanent prophylactic or electrochemical disinfection of drinking water is necessary, as we have this lucky situation of having drinking water quality. In case, and this is now the relevant topic, if a centralized water reprocessing installation is done due to certain reasons in a country or in a region, wherever, the water that is supplied to the treatment unit also has to show the drinking water quality. And you remember the features are that we have these 100 colony building units per milliliter maximum in therein. So, and this is already the challenging topic. Of course, some centralized germ reduction device reprocessing installation could give you a result of drinking water, but you never can ensure that this drinking water quality really will reach the treatment unit itself. Yeah. So, and therefore, of course, Oxygenal is highly recommended to use in combination either with a big water block, with this water block DVGW, or with the bottle system inside the treatment unit, to guarantee that in the thin treatment unit lines you have drinking water quality at the outlet of the spray or cooling water, whatever. Yeah. Important statement, as of course sometimes it's tried to do some changes in the treatment units themselves or build in some water reprocessing devices into the treatment unit. Technical changes on treatment unit are not allowed, as then the declaration of conformity for the treatment unit expires and it leads to a loss of warranty. So water hygiene in treatment unit, that means patient water, is based on having supplied drinking water quality at water inlet. That means you first check that the hardness or the weakness, the softness of your water that you have in your region. You discuss with your engineer, with your distributor, how some regional problems could be solved, and then you select either the big water block DVGW or the water bottle with the functions of permanent and intensive germ reduction to provide drinking water quality for the patient's water in spray cooling, the syringe or the cup filler. And the chemical which is being used is the Oxygenal 6 with depot effect because of the silver ions therein. So another important topic is the hygiene in suction and drain system. Sometimes you might have seen in some situations pictures like that when the service technician has to check some clogged, blocked suction lines. And if we speak about suction, of course we have in mind the suction tubings, the high volume suction, the saliva ejector. We have in mind the suction sieves or filters and the suction machine itself, independent, whether it is a dry suction machine or a wet suction machine. This is not the matter. Both of them, they need to be maintained in the right way. In Maintaining the functionality of the suction system and providing the hygiene functionality, KaVo units provide an integrated flushing program. It is called Hydroclean, and this flushing program should be activated after each patient with only adding cold water into the suction lines inside the unit, flushing the drains, the separation, the valves, and so on. In addition to that, for the hygiene maintenance, suction system requires disinfection, and this we provide by a disinfectant called Decaceptol gel. In our premium units, E70 and E80, we have fully integrated the function of disinfection of the suction system. That means you have a high functional safety with validated maintenance process. For other units, we provide the Decaceptol gel in a manual operation mode. In addition to that, KaVo treatment units provide an additional function you usually do not see. You can maybe a little bit hear it. It's the so-called Aqua Mod. Once you take out, or your assistant is taking out, a suction tubing, in automatic flushing or rinsing of the selective valves inside the suction systems starts. That means permanently a certain dosage of only cold water is given into the suction system when the suction itself is active. In the premium units, this Aqua Mod does have an additional functionality. You see it with this little arrow here in the picture. The premium units do offer an additional outlet where the suction tubing just can be added for an intensive flushing of the suction tubings in some treatment situations with a higher necessity for additional flushing. For example, in surgery or also in prophylactical treatments when powders are being used for air polishing, for example. Another hygiene feature is the design of the suction pieces or cannula connectors. They do not have a round shape, but have integrated air channels in order to avoid reflux of the sucked stuff or adhering to the cheek or tongue during the suction process. The third feature that also is available here is the vacuum stop in all KaVo treatment units. When the user, either the dentist or the assistant, is stepping on the basement top of the treatment unit, the complete suction is switched off. That means there is no need, when you don't like to have the suction, to close the suction cannula itself with the fingers, which is not so hygienically recommended. The chemical we are using in hygiene maintenance is the Decaceptol gel. The fields of application, as mentioned, is to disinfect the suction system, the complete drain, and the spittoon bowl as well. So that means it fulfills the functions of cleaning, of disinfecting, and also fighting some odors that might set up in the suction system. We do have here the feature that it works very, very effective. Why? As it is environmentally friendly, it is economic, fast in use. That means the bottle, if it's not integrated into the treatment unit, provides dosing pump which gives all ready for use the right amount in the material. That means you don't lose too much or you do not save too much. And as it is a gel, the Decaceptol gel, we have the effect that it adheres to all surfaces of the suction tubings, and it's not just flushing them. So we recommend disinfecting the suction system minimum once per day after the work day, and in some cases it might be even recommended to use it twice per day or after some specific situations. That means in the suction system itself we have again a combination of functionalities in the treatment system that provide the functionality and provide the hygiene maintenance in the suction and drain system. It's the Aqua Mod, the automatic adding of water into the suction valves, selective valves and lines when the assistant is taking out the suction tubings, activating the suction tubings. We have a flushing function called Hydroclean, and we have the either manual disinfection of the suction tubings with ready-to-use Decaceptol gel, or the automatic tube washing with automatic supply of the Decaceptol gel in our premium units. Of course, much more hygiene features you will see on or you have on KaVo units. These are removable parts as the handles. That means even the standard handles are easy to maintain, to wipe. We offer here autoclavable handles in addition. The tray, the instruments holder can be removed from the table version, that means the hanging tubing versions, or the silicone pad where the instruments in the swing arm version are lying can also easily be removed and maintained. Silicone can even be autoclaved. The spittoon bowls can be easily removed and also be washed in a thermal disinfector. For the general hygiene workflow, we offer our operating light, which could be additionally switched on or off or changed via sensor operation. That means no need that you go in contact with the operating surface on the dentist's element. During the treatment, all instruments and chair functions can be called up via the foot control. Again, no need that you go with contaminated fingers to the operating panel. And last but not least, the operator's stool operation is possible to be made via a floor plate. You see it here in this version, in order to avoid to touch with the fingers the height adjustment on the operator stool. Regarding surface disinfectants, we give the recommendation in our operating manuals. We tested the following disinfectants and they are proven for all materials you will find in the surfaces, including upholsteries. It's the microsid liquid from Schülke and Meyer. It's the FD322 from Dürr, the Incidine liquid of Ecolab, and the Cabicide of Matrix. You will find in all documents the information. Please perform a wiping disinfection only, no direct spraying of these disinfectants onto surfaces. Sometimes we are asked what to do with the upholstery. We have tried different upholstery care products, but we do not see, when we look into the hygiene structure of the upholsteries in use of these additional products, in order to care the upholsteries, we recommend to remove the dirt immediately with a soft cloth and water, and then follow after that with a surface wiping disinfection by our approved material. So here it's finally up to you whether you like to spend the money on these devices. Sometimes we are faced with some statements that the dentist is facing discoloration on the handles, for example, on the operating foil of the treatment unit. And here it's a very, very important topic to consider. Once you are using single-use gloves, please do not disinfect them with hand disinfection liquids. This process dissolves out of the single-use gloves yellowish substances, and once you touch with these dissolved yellowish substances the dental white parts on the treatment units, this can lead to a chemical reaction and also discoloration, which are not able to be removed from the dental units. In case you like to, or you prefer multiple use of gloves, please select then multiple use gloves, and they can be disinfected. But no disinfection of single-use gloves. In order to make it easy to your practice team, we provide a hygiene plan. It comes automatically delivered with each KaVo unit. You can also, of course, download it somewhere. It's a laminated paper. I do have it here, and you see it, it's laminated. It means it can easily be used in the treatment room, put into a drawer. On one side, you have the recommendations what to do after the treatment, in the morning, in the evening, and weekly for the premium units, where all these processes are run almost automatically. You just need to plug in the tubings into a hygiene center, and on the other page you find the information for the E50 or 1058, where partially the processes have to be run manually or semi-manual. So please look into your documentation and you find there this information on this laminated paper. Okay, then let's come to the instruments reprocessing. Again, we look here into this reprocessing compliant to the German regulations, and here we have to do with the Robert Koch Institute regulations. This is the abbreviation RKI. Robert Koch Institute is the institute which is responsible for all hygiene processes that are relevant for our daily life, not only in dental office here, but also, for example, in schools, in kindergartens, in hospitals, in public buildings, and wherever. When it comes to instruments reprocessing, we do have again an interaction of two factors. It's one, the contamination of the treatment instruments with different microorganisms, as here on this picture, for example, periodontal bacteria. We could have the challenge to fight with another viruses or bacteria that are responsible for example, virucidal flus, for tuberculosis, for hepatitis, or many other diseases that might occur in our global world. So this is the first topic, but this topic goes close together with that you see on the lower part of the slide. It's the just longevity and working of the instruments once the layers of microorganisms built have established inside the instruments. This could lead to an early wear of the instruments when you see just a very hard layer in these sent-in instruments here, which look not very hygienic and of course do not allow to function the instrument well. These bigger parts here are surgical instruments that have been sent into our repair. On the right side you see a rotor cartridge of a dental turbine, and in this lower picture you see an opened head of a carious excavation instrument, where you also find really strong baked layers of dirt inside. So what are the statements of this Robert Koch Institute regarding the requirements of medical products reprocessing? Dental instruments are counted as so-called hollow bodies. This is relevant for dental turbines and contra-angled straight handpieces both, and the following risk assessment has to be applied for them. The differentiation is here into semi-critical B and critical B. What is the difference? What has happened in use of the instrument to the dental instrument? Semi-critical means the instrument has been in contact to mucosa or pathologically modified skin, and here as increased requirements to reprocessing demand a disinfection of the instrument. This could be equal to an unwrapped sterilization or a thermal disinfection in a thermal disinfector. Critical B instruments this classification applies to instruments which have penetrated the skin or mucosa, that means have been in contact with blood finally. And here again the classification is increased requirement, but it is required to disinfect and sterilize the instrument. So the Robert Koch Institute in the regulations, and here the edition, the last edition is June 2012, that the risk assessment and application on patient are generally under dentist's responsibility. That means this classification, which instrument is a critical B or a semi-critical B, this classification has to be done by the dentist itself or by the practice owner. This is not a topic the dental assistant can decide herself. The workflow, according to the German Robert Koch Institute's regulation, looks like that. In the hygiene room, you have a so-called unclean area. You see it here marked with this red color, and then on the right side you see the clean area, and here the instruments have to be handled in appropriate way, either in classification semi-critical B or critical B, beginning from a manual pre-cleaning, just brushing, washing under fluent cold water, cleaning and disinfection, ideally in a thermal disinfector, a lubrication process, then a packaging process if it's a critical B, or just autoclaving if it's a semi-critical B, autoclaving in a steam autoclave, Class B autoclave. In order to handle this topic of the different procedures in hygiene maintenance of the instrument easier, we just recently introduced a new poster which we also provide to our instrument users. I just open it. You see it's a little bit bigger than the maintenance plan for the treatment units. This poster is showing the workflow steps just for the preparation of the instruments and self-protection of the practice staff in regards to avoid any contamination out of a dental instrument. And then both processes, semi-critical B and critical B, in one automatic procedure. Here you see it under 2A, and under 2B we have also a manual procedure which can be applied to semi-critical instruments only. So this is the workflow, and here you find also additional information in. Especially for the pre-cleaning of the instruments, and wiping disinfection is highly recommended for the self-protection of the practice team. Again, we give here in the operating manuals, you see here a little picture out of an operating manual of an instrument. You see the recommendation for the materials. It is microsit liquid from Schülke & Meyer. You have heard these names already. FD322 from Dürr, VLCit Minute Wipes from Alpro, additional product, and KaVo from Matrix. And again, please perform the wiping disinfection only and do not spray directly onto the treatment instruments. Prior, an instrument is to be put into an autoclave, ideally after thermal disinfection. It is essential that instruments are lubricated. For the lubrication, we do provide an automatic device. It is the KaVo QuattroCare Plus, where we provide you 4 adapters for maximum 4 different instruments. The configuration can be done individually to the demand of your clinic. We have available also adapters for other manufacturers' turbines, for example. What is essential here, that all lubrication process happens fully automatic. That means we avoid any over oiling or less oiling of the instruments, and automatically we have during the oiling process a so-called purging process of the spray channels and the drive channels in order again to avoid over oiling. The big benefit, you know, from all automatic devices is, of course, also that you avoid handling mistakes. Many of you might know the KaVo spray. It's a very reliable product in maintenance. It's simple and flexible for the instruments in use with the different adapters, but here again has to be considered that you need a permanent education of your practice team on correct workflow, and you need to undertake high efforts and to invest a lot of work time into setting up the correct workflow. You have to supervise the processes and to look that they are being done in the right way. So 2 modifications are possible. KaVo instruments themselves provide a lot of hygiene features as well as the treatment units. You might know that the latest generations of KaVo turbines, the Master Torques, provide a so-called direct stop technology which offers an anti-retraction effect. That means no contaminated aerosol is sucked into the turbine or into the instrument itself. In addition to that, the coupler, the multiflex coupling, the fast coupler, also does have an anti-retraction valve. So even in use of an older turbine version, we protect as much as possible the treatment unit from a recontamination out of the contaminated aerosol cloud. All KaVo instruments do have surfaces which provide a safe and easy grip, but also allow to perform hygiene maintenance. In our premium instruments, we have this specific Plasmatec coating, metal ceramic coating, which is very easily to brush, to clean from any residues of materials after use. We have very, very minimal joints in the instruments, and we have for all instruments, turbines and low-speed instruments or motor-driven instruments, selection of homogeneous material. The KaVo tradition is here to use stainless steel as a material, not only for the sleeves but also for the inner drive parts, which provide longevity of the instruments after many cycles of thermodisinfection and sterilization all over the working time. So where you can find documents for hygiene reprocessing, I mentioned already that you find information for the treatment units in the operating manual and the care instruction. That means each unit comes supplied with two manuals. This one here I have got as an example is the care manual, where you find very much in detail the description of all germ reduction processes within, and automatically you receive this hygiene plan. I added the material number. You can order it also through your distributor in your country. For the instruments, you find the recommendations how the maintenance process should be, beginning from lubrication over thermodisinfection and autoclaving. You find these statements in each small operating manual that is attached into the box of the instrument, and there again you find the recommendation and statements how an instrument is to be maintained. In case you need anything very fast, our homepage provides a download center where you can also find documents and download them yourself as operating manuals, care manuals, and so on. For those of you who did not work so far with KaVo products or like to get a more closer information about the hygiene system, we provide a hygiene brochure. It is like that, which gives you some general statements and informations about the treatment units and the instruments and how the different features provide you an easy hygiene maintenance for the safety and also value conservation of your treatment unit. We are already at the end of our webinar. We looked into the value preservation and hygiene management in the dental office. In order, you remember I asked at the beginning, would you always like to be the first patient? Yes, I like to be the first patient if both treatment unit and instruments are maintained in the proper way. So now I first like to thank you for your attention to our webinar, for your personal time, and now you have the possibility to ask additional questions. I like to add the information that we provide the slides of this webinar for a download. So if you wish, you could download the slides and read it or share it with your practice team. In case distributors are here also, please share it with your colleagues. So now you are welcome to ask questions. The lines are open. Please feel free. You have an area where you can put in the questions and just send them by going on this speaker's bubble. I see we have even participants from Arizona. Regards to you. So the lines still are open. Thank you, colleague. Of course, we do have your contact details in case some additional questions will arise. Feel free to address your questions either to your distributor or to your KaVo contact person in your countries. We we really have the pleasure to answering even later your questions that might come up later on, as the topic is a challenging one. Thank you for your comments. So I would suggest we wait another 30 seconds for questions. We have many comments here, but no real questions. So, yeah, dear operator, I would suggest 30 seconds. So, once again, I like to thank you very much and to say goodbye to you.
We would like to thank our speaker for sharing her knowledge and expertise with us today. We would also like to thank our sponsor for making this online course possible, and thank you, our wonderful audience, for your interest and participation. The CE quiz is now available online on the course page, and completing it will allow you to earn your ADA CERP CE credits. The recording will be posted online within the next 48 hours. You will receive an email notification with a link to the recording. Thank you again, take care, and goodbye.